Hi, everyone, and welcome back. In this presentation, we're going to talk about assent in ABA. Assent is a hugely important topic. I could probably do a couple hours on this. This is my main research area, but I'm going to give you an overview, and I highly encourage you to get more training in this area. What is assent? Assent is an agreement to participate in services. It's not legally required, but is ethically expected. It's an ongoing process. It's not something like yes, and then we're done. You have to continually assess assent and determine if you have assent. Assent can be expressed verbally or non-verbally. So we can still gather assent from non-speaking individuals. And that's really important. A lot of people tend to believe that you don't need assent from non-speaking, but yes, you do need assent from non-speaking. Why does assent matter? It's hugely important because it's about the person's autonomy. When we think about individuals with disabilities, especially a non-speaking person with an intellectual disability, these more severe cases of disability, most of their life they go through learning to comply with everything. Because when they don't comply, it's usually behavioral. So they engage in tantrums or aggression or self-harm. We train them out of all that and we train them to be compliant. This is not the way things should be done. No person should be completely compliant. I think about my own kids and how much autonomy they have and how many no's I hear every day, which I think is typical. It's typical for a person to assert their autonomy, to say no, to even sometimes try to, control my autonomy. And we don't give people with disabilities that space to have autonomy. Assent allows us to give them the space for that. It builds trust and rapport, so they will trust you more if you honor assent and if you look for assent and you utilize assent. It enhances cooperation and learning, so they feel more empowered. They'll become more independent. They're also safer, knowing they can say no. In any situation, we can't say no. We're more likely to get abused. It makes sure there's no coercion going on. So you'll learn a lot about consent. We'll talk about it. So your agency, clinic, or school has a consent form, which the legal guardian says, like, hey, I'm saying okay to this therapy. And you talk about, like, this is what we'll work on. These are the alternatives to this therapy. It's required for treatment. Anyone, if you go to a doctor's, you're going to do a consent form for if they want to give you medicine or surgery, you do a consent form. Any therapy, if you go to psychotherapy, if you go to talk therapy, they do a consent form. It's everywhere. Like anytime someone's treating you, we give consent, and families give consent for this therapy. Assent is exactly like consent, but it's given by the learner. If they're under 18 or they're conserved, and they'll be conserved if they're not able to make medical and educational decisions for themselves, their parents will then conserve them and continue to make those decisions. But ethically, we should ask the person, can I do this? Do you want to do this therapy? Are you okay with these goals? Is this what you want to work on? It can be withdrawn at any time. It respects the learner's autonomy and enhances cooperation and learning. So when we're doing, and hopefully your supervisor helps you with this, what I'm suggesting is that we assess for assent during the FBA process at the beginning. These are the ways that this client shows they're happy with everything, and it could be different for every person. So smiling, approaching, participating, nodding, saying okay, verbally going like, I want to do that for our speaking clients. Shaking head no might be dissent. And engaging in tasks willingly, you would have a list of how this learner shows assent, and you would want to make sure you're seeing that throughout the therapy. And if you're not, we would modify the therapy so that you are. And that's the basis of a lot of my research, so that you can always have assent for both behavior techs, BCBAs, and supervisors. How do they withdraw? They might avoid, walk away. They might say no, cry, shake their head, shutting down, or engaging in problem behavior. And this is where it gets hard. Like, we might be working on problem behavior. So they show problem behavior. You're supposed to work on it. Is that withdrawing assent for the therapy, or is that should we work through that? I discuss this so I have a comprehensive Assent workshop. I discuss this. It depends on the situation. If that problem behavior is harmful to them, harmful to others, or property destruction, we might need to work on it no matter what, because we're keeping them safe, other people safe, the environment safe. But in most situations where that's not the case, like it's just a tantrum, I would say slow it down. If you're seeing a couple tantrums for these programs, slow it down. The program's not right. Let's modify the program so you get the willingness to engage with the program and figure out what we need to do with the program to make it more fun for the person or something they want to work on. And you want to assess, like, maybe they don't want to work on this goal. Maybe this isn't their thing. And that happens a lot with social skills. You'll get a kid just resisting social skills training. Do they want to get better social skills? Do they want to converse with their peers? Sometimes people don't. I've seen that so many times. The environment will, as they get older, they'll want more social skills, but at that time, they'll be willing to do it because they want it more. But if they don't want to, and they want to sit in the library and read every day at recess, why can't we let them do that? I think allowing autonomy and giving them things they might want to do is really important. And you might have to reassess the whole situation with your supervisor. If they withdraw, you want to pause the activity. So you might, occasionally you can do one more time. Maybe it was just, how you approached it, or maybe they just need to calm themselves down, but maybe you pull the activity for the day. Offer choices or breaks. Give them a break and see if they'll come back and try it. They might just need some time. You might want to try again later. And then if it seems like they're always withdrawing their assent for this one program, like you see that at least 3 times, you want to go talk to your supervisor and determine what you should do. Like, are we going to run that program? Is that important? And if it is important, how can we modify it so you have assent? Assent in action. So the tips, you want to give clear, respectful instructions to the individuals. Use simple, direct language to explain what you'd like the learner to do. Avoid commands or demands. Watch for signs of assent or dissent. I would be taking data on both. So the easiest way, what I suggest, and this would require a lot of help from your supervisor, is I get their frequency of assent in just their everyday life. Like, how often are they smiling in an hour period? They smile approximately 5 times in an hour. If it drops down to 1 during therapy, I'm going to try to modify therapy to bring it back up to 5. That's how I suggest doing assent. It's not always clean, but you just do your best with like the data you can gather. And same with dissent. You track the dissent, the typical dissent in activities they like. Then you track dissent during therapy. And if it goes up a lot, then you may want to modify. Always offer choices. This will increase a sense of control. I have a whole section on choices. It's super important that you provide lots of choices. Reinforce participation, positively acknowledging the learner, praising the learner, and respect. You want to make sure if they decline to participate, you don't force it. Validate the choice and try again later. And if they still don't want to, you might need to talk to your supervisor. Okay, so here's an example. You ask Ava to set a table. She walks away and lies down. Your options would be block her from leaving, pause and offer a choice and reinforce the return, or ignore and keep talking to her. So the right answer would be you want to pause, offer a choice, and reinforce if she would return. So that means we respond to what learners are telling us. Ava's body language is a no. We honor the no and we engage in a positive way when she's ready. One thing I see behavior techs not do well is slow it down. There's like this pressure to get like the goals down, get the programs done. If you're seeing a lot of dissent, just slow everything down. You're not going to work on 10 programs. You're going to work on 2 programs today and do a lot of fun stuff. It's okay to slow down therapy. We can slow it down for a couple sessions and then try working on 3 programs and build it back up. Assent is our learners' ongoing agreement to participate in services or activities. It's essential that you do this and show respect and care so they feel safe with their interactions with you. If your company isn't really looking at this or isn't really utilizing Assent in any way, my best advice to you is, one, you could ask them to start including this. And if that doesn't work, I might look for a different company, honestly. I would not be comfortable at this point in my career engaging in therapy without a strong Assent policy and utilizing Assent and dissent through therapy. Okay, thank you.